Hi, good evening. This is going to be vlog 6 of the OCT 741 vlog assignment. So today I wanted to talk about more of a self-reflection of how my confidence is during my fieldwork setting. And guiding those questions are from the article from Derdal et al. 2002. And then I'm guiding my questions using the Likert scale regarding the question. So, first question is how confident am I with interacting with clients? I feel that I am a 5 regarding interacting with certain clients. I feel like that I am myself am a naturally sociable person. I can go ahead and try to find ways to connect with my patients, try to recall things they mentioned before in our conversations and try to introduce that into our conversations regarding treatment as well. And then trying to delve deep into their occupations, such as their ADLs, IADLs, and then trying to find a way to connect back to the patient. So that's why I feel strongly very much about how I'm socializing with these patients. I am also very much strongly agree that I am confident with interacting with other team members during my field work. I am able to talk comfortably with the other disciplines, such as the physical therapists, such as the nurses, and other OTs as well. So I am pretty confident in that scale. Some things that I do feel that I need to work on with patients and with other disciplines, especially, is delivering effective verbal presentations and trying to handle disagreements that may arise. I myself am not really one to try to look for conflict. I'm not one to try to. I am. When conflict arises, I am trying to find ways to alleviate that. However, sometimes trying to find a middle ground with other people can be very difficult for me, trying to find ways to please certain people who might not agree with some of my options for treatment is what I'm trying to say, or some of the options, especially for example, if I have a patient, last I had a patient last time who really wanted to take a shower, but they were a Max Assist patient, so I had to let them down nicely that I really couldn't feel safe letting them take a shower on their own or with the help of others. So I tried to compromise by giving them a sponge wrap, but at that time help getting I was getting assistance from my clinical instructor in trying to alleviate that conflict and trying to get options into how to alleviate that conflict. So using my own clinical judgment and using the kind of the guidance from my clinical instructor, I was able to alleviate that conflict nicely and then get the results and outcomes that B and the patient required. So for me, I think I need to work on more alleviating conflicts with if a patient somehow disagrees with the the treatment that I'm providing for them, or if there is, let's say, a physical therapist who may disagree with me with their discharge plan, trying to find ways to kind of compromise and then communicate with them on how and why I feel the way I feel, and then trying to make that as professional as possible. I believe I do a good job in remaining professional, keeping my composure and communicating that with other therapists, but I do need to work on trying to also stand my ground a little bit and try to kind of defend on why I feel the way I feel. I feel why this is going to be appropriate for my patient. So, and then last thing that I do feel like I need to work on is trying to develop goals with the patient. So far, with adaptability comes with acute care. I am trying my best to adapt certain goals if sometimes they don't meet certain criteria during the week, and I am trying to kind of pivot and think of alternatives and think of ways to achieve these outcomes and goals for the patient. So trying to work more onto that aspect as well. So yeah, that is all.